Hello, dear friends. Dr. Harold Benson here, a physician with over 30 years of experience treating elderly patients. Today, we'll talk about a fruit that seems so simple and commonplace that many don't even take it seriously. It's always available in stores, inexpensive and accessible to everyone. It's the apple. Yes, apples, which we've been eating since childhood, can become one of our most important health allies after age 60. But unfortunately, many elderly patients underestimate their power. Let me tell you a story. A few months ago, Mr. Ronald, 68, came to see me. He complained of chronic constipation, lethargy, and loss of appetite. "Doctor, I'm taking blood pressure medication, but otherwise I'm feeling worse. Maybe I need some expensive vitamins?" he asked. When I looked at his diet, it turned out that fruits and vegetables were almost non-existent. "I prefer meat and bread, and I consider apples empty, because they're just sugar," he said. A week later, I had a consultation with his neighbor, Mrs. Joan, 72. She looked cheerful and active, had good test results, and was in a great mood. When I asked her secret, she smiled. "Doctor, it's simple. I eat 2 apples every day, one in the morning, one in the evening. I call them my health pills." The difference was enormous. Mr. Ronald had digestive issues, excess weight, and fatigue. Mrs. Joan was a normal weight, had a healthy gut, and a strong immune system. And this is no coincidence. Apples contain fiber, vitamins, minerals, and unique substances that support the heart, blood vessels, intestines, and even the brain. Today we will discuss why are apples beneficial after 60 years, how they help the heart, blood vessels, and digestion, why apples reduce the risk of stroke and dementia, how to eat apples correctly so that they bring benefits and not harm. And of course, I'll give you a step-by-step plan, how to include apples in your diet so that they become a true fruit of youth. Stay with me until the end, and you'll be surprised how a simple and affordable fruit can prolong your activity in life. First, let's figure out why apples are considered one of the healthiest fruits for people over 60. At first glance, there's nothing special about them: water, a little sugar, and a hint of tartness. But dig deeper, and you'll discover they're a true treasure trove of health. After age 60, cardiovascular disease becomes the leading health concern. Blood pressure, atherosclerosis, and the risk of heart attack and stroke are all directly related to lifestyle. And here, apples act as a natural shield. Firstly, they are rich in soluble fiber, pectin. It helps lower bad cholesterol levels in the blood. Research shows that eating at least 1 apple a day reduces the risk of cardiovascular disease by 20–25%. Secondly, apples contain potassium, which gently lowers blood pressure, improves heart function, and removes excess fluid. This is especially important for people with edema and hypertension. Apples also contain quercetin, a powerful antioxidant that protects blood vessels from inflammation and aging. Many patients who began eating apples regularly report more stable blood pressure and improved overall well-being. The second problem after age 60 is constipation and sluggish digestion. Metabolism slows, bowel function deteriorates, and medications often make the situation worse. Here, apples act as a gentle and safe remedy. They are rich in insoluble fiber, which stimulates bowel function, helps form soft stools, and relieves constipation. But that's not all. Apples contain organic acids that improve liver and gallbladder function. Many patients report that after incorporating apples into their diet, they feel less heaviness after eating, and their digestion becomes easier. Another point, apples support healthy gut flora. Pectin feeds beneficial bacteria, which strengthen the immune system and reduce inflammation in the body. Many people over 60 complain, "Doctor, I barely eat anything, but I'm still gaining weight." This is due to a slowing metabolism. Apples help here in two ways at once. They are low in calories, only 50–60 calories per fruit. Due to the fiber, they keep you full for a long time and reduce cravings for sweets. If you replace your evening snack with a cookie and an apple, you'll start losing weight and your blood sugar will stabilize within a few weeks. This is especially important for people with type 2 diabetes. After age 60, we begin to worry not only about our hearts, but also about our memory. Research shows that regularly eating apples reduces the risk of dementia and Alzheimer's disease. This is due to quercetin and other antioxidants, which protect the brain from oxidative stress. Moreover, apples stimulate the production of acetylcholine, a chemical important for memory and concentration. It is no coincidence that in England there is a saying, "An apple a day keeps the doctor away." An apple a day keeps the doctor away. Osteoporosis is another common problem after age 60. Apples contain not only calcium, but also boron, an element that helps retain calcium in bones. This reduces the risk of fractures and strengthens joints. Many older people get colds more often than they'd like. Apples are rich in vitamin C and polyphenols, which boost the body's immune system. In autumn and winter, apples become a true natural shield against infections. I would like to stop here and dispel a few misconceptions. Myth 1. Apples are all sugar. In reality, they contain only 10 to 12 joule of sugar per 100 grammars, and fiber slows its absorption. Apples are one of the safest fruits for diabetics. Myth 2. Apples ruin your teeth. Yes, apples are acidic, but that acid actually cleans your teeth of plaque. Just don't eat apples right before bed. Myth 3. Apples are not good for gastritis. In fact, if you have gastritis with high acidity, it's better to choose sweet varieties and eat them baked. However, if you have low acidity, sour apples are actually beneficial. The question I hear most often is, "Doctor, how many apples can you eat a day?" The answer is simple. 1–2 apples a day is enough. No more is needed, as this can cause excess gas or abdominal discomfort. It's healthiest to eat apples fresh, with the peel, as that's where most of the quercetin is found. However, if you have stomach issues, you can bake apples. They retain almost all of their beneficial nutrients. I always advise my patients to choose different varieties. Red ones are rich in antioxidants, green ones contain less sugar, and yellow ones are better for the liver and digestion. It is better to eat apples in the morning or afternoon so that the fiber stimulates bowel function. You shouldn't drink a lot of water with apples at once. This can cause fermentation. An apple is an ideal snack between meals. Dear friends, let's sum it up. Apples are more than just a typical supermarket fruit. They're a true, universal doctor that takes care of your heart, gut, bones, immunity, and even memory. After age 60, when the body is especially vulnerable to chronic diseases, apples become a simple, accessible, and very powerful tool for maintaining health. Let me tell you the story of my patient, Mr. Howard, 70 years old. He came to me complaining of a heavy stomach, constipation, and fatigue. "Doctor, I'm afraid to eat fruit anymore. It seems to make it worse," he said. We started small. I suggested he eat an apple every day, or better yet, a baked one, so as not to irritate his stomach. A month later, he returned for an appointment. His words delighted me. "Doctor, I've started to feel lighter. My bowel problems have gone away, and I'm even sleeping better." He also noticed that my cholesterol had dropped, and my blood pressure had become more stable. And it's not a miracle, it's science. Just one small fruit a day can trigger a chain of positive changes. But it's important to remember the golden rule: everything in moderation. You don't need to eat kilos of apples. 1 or 2 a day is enough. And choose different varieties. try fresh and baked versions, and add apples to porridge, salads, and yogurts. Remember, an apple is a symbol of health. It's not for nothing that they say, an apple a day keeps the doctor away. And this is especially true after 60. Friends, I want you to treat your diet like medicine. Simple foods, which we often underestimate, can become a true shield against old age. If you found this video helpful, please like it, subscribe to the channel, and be sure to share it with your loved ones. Let us know in the comments. Do you like apples? Which varieties do you prefer, sweet or tart? This was Dr. Harold Benson. Take care, eat your apples, and stay healthy.